talk about the importance of behavioral medicine in MS, and why is this so especially relevant for men in this disease?
Here at the Mellen Center, I'm very proud to say that, we're in terms of a MS clinic, we're the only house behavioral medicine kind of department within an MS clinic in the nation. So at the same time, that's also a little bit frustrating because, this is something that, in my opinion, needs to be within the integrative model, just as physical therapy is, social work is, occupational therapy. I think we all play an important role because MS is very complex. It's not just sorry, I kind of jumped off there.
Oh, no worries.
There we go. So it's a very complex disease. So it's not just touching one area. So we just as it's complex in itself, we need to kind of come at it in an integrative way to really be there and care for. And in terms of that for men, I think it's just another avenue for us to be there for not only overall patient populations, but also for men too. I think that when we're able to have these discussions about gender and to have more resources and to have more discussions about these things, and what we're going to see here is potential increased levels of treatment adherence from men more open to coming in and talking about their experiences in terms of support groups, individual sessions, you name it. It's more of men participating within their treatment rather than, I don't want to say rejecting, but just having this conflict with it. I think that everything you think about in terms of men, I mean, coming in and help seeking and being treated kind of goes against everything that we previously talked about. So us having kind of this integrative model that includes behavioral medicine is so important to be there and well-round kind of the integrative model for the individual patients.
Do you feel as though assessments like the CMNI tool should be incorporated more frequently into patient visits than they normally are currently right now?
Sure, I think right now they're not included whatsoever, and I think that that could be an area. I'm not sure if the CMNI 46 they're exploring making a shorter inventory. So they're looking, I believe, that there's a CMNI 30 that just came out. So as everything in the assessment world, we're getting smaller and smaller to be kind of more efficient. So potentially, I think that would be great. I think something that can, there's other models too. I think there's the male role norms inventory by Dr. Levant. That one's relatively brief. I think it's 21 questions. So there's opportunities here that we can screen for this, because what the results of my study have shown is that adherence to traditional masculinity norms, kind of in that rigid way, we found associations with higher disability status, increased risky health behaviors, also lower levels of physical health scores, health promotion, seeking social support. I mean, these are really big deals. So I think when we can identify this as someone that maybe has certain, and I don't want to kind of cloak this as kind of traditional masculinity is all bad, but what we're seeing is there's a nuanced relationship here where certain gender roles don't jive well in terms of treatment adherence and maybe have an increase in risky health behaviors and seeking social support and health promotion. And when we can identify those, just as we do with depression, just as we do with anxiety, this can be a tool that can be used to really support the individual patient and kind of steer intervention that can be really salient and very effective.